job. Towards me, you're not going to fall. All the way out. Woo! Right. It'll drop right there. Good job. For whatever reason you want these out at any given point in time, please just clap your hands for me, okay? Mm-hmm. If you're unhappy and you know it, clap your hands. I think that's how that song went. Hey everyone, thank you so much for clicking on the video. Today we've got a very interesting patient with a little bit of everything. A little bit of jaw, a little bit of neck, a little bit of lower limb, a little bit of back. Everything you'd expect to find on this channel. So thank you again for clicking. I really do appreciate your support. If you haven't already, please hit that subscribe button down below. Really trying to hit 10,000. We're really close, guys. Please help me out. Again, thanks for clicking. I hope you have a great rest of your days and enjoy the vid. Jess, really good to meet you today.
Good to meet you.
Thanks for coming in. Jess is a volleyball teammate of a regular patient here, and she's in today dealing with some neck tension, upper back tension, kind of the classic stuff that you would go see a chiropractor for. So Jess, do you mind sharing a little bit about what brought you in today?
Yeah, I pretty consistently have like upper back pain and neck tension. I do get headaches sometimes. I think from like maybe clenching my jaw a little bit.
Do you feel like you grind your teeth a lot? Do you have a mouth guard?
I don't grind them, but I know I squeeze them really tight. Like sometimes I wake up and I'm like, yeah. Okay, interesting. Yeah.
All right.
So that I don't have a mouth guard. I just don't like sleeping with them in.
Fair enough. I wouldn't either, probably. They sound very uncomfortable.
Yeah.
But
it has been recommended to me, but I've declined that recommendation. And just like I have a pretty constant like tightness in the middle of my back that if I ever see like any sort of RMT chiropractor,
you get them to kind of work on that area.
Yeah, and they poke it and I kind of. I try to not move, but it's involuntary.
Okay.
So
Interesting. So just briefly with the with that kind of jaw clenching complaint, aside from the mouth guard, have you had any other recommendation? Have you seen anybody for that at all, or?
No.
Do you feel like you have it during the day, or is it really only when you wake up in the morning?
Sometimes during the day, like if like I'm working on the computer and like I feel like I'm really focused, and sometimes I feel like I squeeze my jaw when I'm very focused.
Okay, so almost like an unconscious effect.
Yeah.
There. Okay. Did you have an IT band issue as well? You mentioned that. Yeah. So what's going on there?
So like my hip is quite sore.
Okay.
I did a 10K, which I'm not a runner.
That's okay. That's very impressive for someone who's not a runner.
Yeah. But it was kind of downhill, and I think I had a bit of an issue with it before. And like it was always kind of sore right at the sort of bottom of my glute.
That's kind of like the hamstring insertion
area.
Okay.
And then after the run, like I couldn't sort of walk with my leg.
Were you having trouble like kind of straightening the leg out, or what was happening?
Yeah, I was having trouble bending it. Then I did some Googling.
Oh, Dr. Google. Okay.
Yes, and Dr. Google gave me some stretches, and I did the stretches, which were mainly like lying on my back and like putting my foot up and like holding it over, and that seemed to release it a bit.
Good. Dr. Google helps. That's good. Okay.
So we could walk, and then I've proceeded to like continue exercising, and it's just continuing to be a slight issue. But
so it's been improving though, eh?
It has been improving, but then if I don't stretch it for a couple days, it's not.
Okay. Well, we can take a look at that as well.
Yeah.
She pointed right to the hamstring origination, so it could be a hamstring issue, it could be an IT band issue. I'm happy that Google helped in this case.
Yeah.
Because sometimes Google can make things worse, but Jess lucked out in this case. So we kind of got our work cut out for us for today, which is totally fine. I'm here for it. No, don't apologize. This is good. We like these kinds of videos. So what we're going to do is we're going to do a physical exam, okay? And then we're going to get into whatever treatment methods I think are going to be most effective for you, okay? Did you have any questions about that before we get into it?
No?
Awesome. Let's get started. So Jess is having a suspected IT band issue. Now, the IT band connects from the outside aspect of the hip right here, comes down, connects almost down into the knee area here, all right? You can't see it because it's kind of at a bad angle, but one test we can do for that is something called Auber's test, where we have the patient lay on their side like so. What we're going to do here is we're going to straighten the leg, bring it back, and then let it go against gravity. All right, so in this case, I'm just letting it go. It's just hanging there. Now, Jess, is that lighting up any kind of pain, discomfort, or anything in the IT band region for you here?
No.
No? Okay. So A, she's not complaining of any discomfort with this, and B, we'll see that the leg drops down past the table, all right? Meaning that if there was strain, if there was something here, the leg wouldn't be able to do that. We'd be hanging out at about right here, okay? So I'm not convinced that this is actually an IT band issue. Jess, you were saying that motor discomfort is kind of like at the bottom of the glute, kind of in that region there?
Yeah.
Okay. That really is the hamstring origination region, so I think that's more where her issue is going to be coming from. We'll check that out in a bit. What I'm going to do is I'm going to get you to take a big breath in.
Okay.
And breathe all the way out for me.
Oh.
That was a really good one.
Yeah.
Good job. Still breathing?
Yeah.
That was a lot. That was quite a bit. I'm very impressed we were able to get that all on one go because there's quite a bit of muscle tension. I wasn't sure I was going to be able to get through it, but you did great relaxing. You fully trusted, so thank you for that, okay? And to take a reinforced thumb and try to get in at the head of that hamstring right.
Oh.
So that's where you're feeling your discomfort at.
Yeah.
Now if I keep a thumb there and then I stretch that out, that feels pretty not great.
Yeah.
I felt at the end there was definitely a twinge. Okay, so this is not an IT issue. Okay, this is very much a hamstring issue. So you're going downhill. Maybe you just went a little bit too much, but you've been saying also that this has been getting better with time, yes?
Yeah.
Good. So that's the good news, is that all you really need to do with this is a little bit of time and keep stretching out as you found. I think you've been doing the correct thing for it, but how long ago was this 10K once again?
Maybe like a month ago now.
A month ago? Okay, so that's still taking a while. So what we can do for this hamstring then, it's a rather deep tissue, because in order to get at the hamstring tendon down here, you do have to go through the glutes, which are the largest muscle on our body. So the way that I typically deal with that is with acupuncture in this clinic. We might not want to do that through Lulu's today, but that's just something to consider for the future.
Okay.
If you do want to try to get a little bit more aggressive at handling this tendon, you wear shorts, and we're able to kind of go in through that region there, okay? Just food for thought for the next time. But at least now we can say definitively, not an IT band, it's a hamstring strain for you.
Okay, Google led me astray.
Google led you astray, but it also gave you some stretches that still helped,
that happened to work.
They happen to work, and that's the way that it usually goes with Google anyways. Did you like match your outfit on purpose? Well, obviously you knew you were going to be on camera, so you're like, I want to be like all synced up, you know, like the pink actually, like I like the, are they complementary colors? I don't know, I'm not art, but the
I like brown and pink.
they match the nails.
Yeah.
All right. I'm going to get you to take a big breath in for me. All the way out. I'm going to roll you towards me. You're not going to fall. Woo! That sounds like
feels good.
That sounds like a million views right there. Okay. Bottom leg is straight. Top one is bent.
Okay.
Hips are coming a little bit closer to me. Thank you. And then just sink the hip in that position. Good. Breath in. All the way out. Woo! These are good. These are.
I feel like I can breathe now.
Okay, I'm very happy to hear that. That's good. So, what is it that convinced you to join up for a volleyball league?
I like team sports. I think they're fun. I like they're for the social aspect.
Fair. What? You're not there to dominate the competition?
No. I'm not diving on the sand.
Neither would I.
I'm not.
I'm too much of a precious flower. I don't know. The best way to get this done is for you to turn as far as you can to the left, and then to just try to pretend that this hand is your pillow at home, right?
Oh.
Good job. How was that? You're okay? You're still breathing?
Yeah, I'm still here.
Okay. Now, in the past, have those like hurt for you, or like what's it's just the feeling's weird?
It's just the feeling's
Got
weird.
it, okay.
The sound.
You love the sound if it's everywhere else.
Yeah, but
there.
it's too close.
Nah, I get you. Yeah. And the neck adjustments, we always do hear them a little bit louder than other adjustments because they are literally inside of our bodies, right by our ears. So very, very common to get that complaint. Okay. So I'm going to go ahead. Same deal, just turning to the right. But I'm going to come at it from a different angle. Drop right there. Good job. You did great.
Thanks. It feels good. It feels balanced after you do both sides.
Oh yeah, no, it's gonna definitely feel lopsided if we're only doing one, especially with the tensions you have. So Jess was also complaining of kind of a clenching jaw issue too. So the first thing that I wanted to check out was I'm gonna get you to, these are her masseter muscles right here, okay? They're our strongest clamping down muscles. I'm gonna go ahead, hold this and get you to open as far as you can. That doesn't really light up your complaint at all, does it? No? Okay, so we're not looking at tension of the masseter. But what I usually look for as a chiropractor is tension of a muscle called the pterygoid muscle. And you guys have seen this on my other TMJ videos if you watch them. But the pterygoid is located between the teeth and the mandible, the jaw itself. So I'm going to take, well, my pinky, which isn't exactly small, but it's the smallest finger I got, and I'm going to try to palpate it to see if we get any discomfort with her. Now granted, I'm only going to press like a 1 or a 2 out of 10, but let's see. So just going to get you to open your mouth here. I'm going to take that pinky, going to go in right, I got to get around that, right in through there. Okay, so again, I'm pressing maybe a 2 out of 10 and she's wincing. All right, so that's pretty not comfortable for you. Yeah, this isn't comfortable for anybody, but that level of discomfort with that level of pressure, it's not really normal. Okay, so I'm going to want to try to release that. Let's check this other side too, actually, here. And gonna go right in through there. Same deal. Okay, so I'm gonna try to get those muscles to relax by putting that pinky contact, taking my smaller massage gun and vibrating the pinky like so. Heads up, this might be a little uncomfortable. If you want to stop at any time, you can just start blinking your eyes for me pretty quickly, and I'll take my hands right out. Okay? So you're a sport for doing this, by the way. This is not comfy. I get you to open on up for me. We're going to go for 30 seconds, 3 times. Okay? So we're going to find that area. Where did it go? There it is there. 2, 3, and here we go. Oh, I should probably get my hand right out of the center there. There we go. That's how we do that. 10. Probably weren't expecting this when you drove in today, yeah? Yeah, no. You're okay. 20. 28, 29, and 30. Woo! You okay?
Yeah.
Itchy nose?
Yeah, it makes my face itchy because it's shaking it all around.
Very common response. Very common response. As far as the tenderness there goes, was that tolerable, bearable?
Like, it was bearable.
Okay, but not comfy, yeah?
No.
Probably not.
Yeah.
Right. We got 2 more sets on the left side.
All right.
Yeah, this is the left side, okay? So whenever you're ready, open that up. Good, I'm going to get at it. So I'm trying to get around. There we go. And so whenever you're ready, we'll do the other side as well, okay?
All right, let's do it.
Let's go for it. 1, 2, 3. Find that contact right through there, and then try to get it out of the way there. There we go. 3, 4, 5, 6, 7, 8, 9, 10, 28, 29, and 30. Okay, good.
Whoa.
Job. Jess, you survived.
I appreciate the counting. That was helpful.
Yeah, no, I'm not just going to leave you there indefinitely because I guarantee you're probably kind of like 1, 2, 3, 4, 5, 6, 7.
Yeah.
Get me done, you know. All right, so we just finished doing the vibration therapy in for the pterygoids there. The next thing we're going to do today is we're actually going to do some acupuncture, some dry needling to that region. And look at that smile. She is clearly excited. There was no coercion here whatsoever. This was not done for the YouTube videos. It's done because it can help with jaw tension there. So you asked me a question, you can ask me again now.
Yeah, why would there be tension here?
That's a tough one to answer because it could be for any number of reasons, all right? It could be you just carry your stress there. A lot of people will carry it in their traps, which then leads to the neck, which then can lead to the facial muscles. It's just the next one up the chain. There's many different ways to try to approach these jaw-related issues. Like one is, of course, the mouth guard. Another is actually through therapy, through psychotherapy. If you are a very, very type A high-stress person, and this psychological factor is causing you to causing you to clamp down, the only way to fix a psychological condition is through psychological methods, right? So that's another way to go. Obviously, here we're addressing the musculoskeletal component. So if it really is because those muscles, for whatever reason, just experienced a high degree of tension and are now very, very tense up, we can take care of that here, right? But yeah, you tell me, why are you so stressed out all the time?
I don't know.
All right,
I think I'm pretty relaxed.
I hope so. That's the best way to live. That's the only way to live, honestly. It's not worth stressing out about constantly.
Yeah.
All right, so I got some sanitizer here. Okay, just because we want to try to sanitize the areas beforehand. You go right in through there. Okay. Sorry, if you have foundation, I'm taking it right off.
Okay.
Yeah. Okay. That's good there. That's good there. All right, take my gloves off and sanitize my own hands. What I'm looking for is a little hole or a little window kind of in the mandible region, just medial to the TMJ. So that's going to be right about there, coming in perpendicular, just like that. Good job. Was that okay? Give me a thumbs up if it was. Perfect. Just give me a thumbs up. Now we're going to do that same deal on the other side there. If for whatever reason you want these out at any given point in time, please just clap your hands for me, okay? Mm-hmm. If you're unhappy and you know it, clap your hands. I think that's how that song went. Okay. That one unfortunately missed the window. So we're going to try one more time, and it might just not want to be cooperative today, but we'll see. Mm-hmm. I'm actually going to reposition myself for this one. Right there. There we go. Good job. And now we wait and take a pre-volleyball nap. It's been about 10 minutes, so we're going to go ahead and take these needles out and let Jess speak once again. There you go. Needles are out. You're good to talk. Okay, there you go. Still with me?
Yeah.
Don't hate me yet? I've tortured you in a bunch of different ways. We're not done yet. We got one more thing to do. All right.
The hardest part was not talking for 10 minutes.
Even when you were, I left and I made a coffee. So she was talking about talking to herself there. I don't really know. Whenever we've got a lot of tension in that upper back, the traps area, what are we going to do? Of course, we're going to address the fascial complaint. So fascia, it's a superficial structure that exists on top of our muscles, between it and the skin. It helps everything to slide without creating friction. That's important because if we create friction on our movements, we perceive that as reoccurring stiffness, pain, or injury. So let's get started. She's already been briefed on the petechiae, which is the redness that can form up. If at any point in time you want me to stop, say stop. Otherwise, I'm going to ignore any oohs, ahs, or outs that you make, okay? We've already got some of that redness showing up right here. She's not surprised. Based on the emphasis of that, yeah, no, she's not surprised at all. No.
No. Why does the redness show up?
So the redness is actually what happens when we release a formed fascial knot. Oh. You know how you can get knots in your muscles, like a muscle knot?
Yeah.
We can get the exact same concept. It's technically an adhesion, not a knot.
Yeah.
But the exact same concept within the fascia itself. Oh. Now fascia, because it's superficial, if I were to just like deep tissue massage you, which probably doesn't feel great, but if I were to just do that, it penetrates right through. The fascia doesn't actually do much for it. But when we use these tools, which I love so much, and we scrape over the adhesion, it physically breaks it up. Now that causes a microbleed. Technically this is bleeding, but all bruising is bleeding, right? But she's not like bleeding through the skin or anything. Like, it's not wiping around anywhere. But that's what's causing the redness, a formed fascial adhesion that has since been released, right? So it's a little bit like a scratch and sniff snot, right? That's just weird. Scratch and find. You remember those old like 90s things you'd scratch, you'd like find the treasure or something? It's a little bit like that. What we'll see is that if we're consistent with this, there will be less redness and less redness and less redness each time until eventually there's either no more or only minimal amounts forming between appointments, right? Okay. Coincidentally, you'd probably feel a lot of your stiffness is going away. Yeah. Have you ever had a lot of fascial work done? My guess is no.
No.
Exactly, yeah. So very common that my patients who get regular massage therapy but don't experience the relief that they'd expect, that it's actually related to a fascial complaint, because not many practitioners give fascia the time of day that it really deserves.
Interesting.
So if that sounds like you, by the way, watching at home, you get massage after massage, you still feel stiff and tight, but you've never had any fascial work done, highly recommend that you see a practitioner that does this method. Bunch of different names: Graston, Smart Tools, Instrument-Assisted Soft Therapy, Gua Sha, something like that. Should be able to help you out. And if you're in the GTA, I'd love to see you myself. So, shameless plug, I guess. This is marketing, guys. I make these videos so that you choose to come in and see me. Like, Jess, how do you feel right now?
I feel good. I feel like a little bit of pain from like the areas we worked.
It's very normal, especially after the first one. Yeah.
My hip feels actually a lot better.
Okay.
Like driving to work in Toronto has been rough. Like always needing this hip sort of to stay in one position. And yeah, even sitting in a chair has been uncomfortable, but it feels a lot better now. So.
We'd hear that.
Yeah.
I'm glad we could have like an immediate effect on you if that's the
Yeah.
case. Again, regarding the soreness, don't sweat it. Extremely common. That's why it's the first thing that's on any consent form. You might be a little bit sore afterwards. The hip, it's definitely hamstring and possibly also SI related. We talked about that briefly, just because the whole pelvic complex is very, very, very interwoven.
Yeah.
So being able to free any of that up should feel pretty good for you. Okay. You're young, you're active, you play volleyball, you take good care of yourself. So I'm not like concerned about the severity of these kind of conditions. I think you could very easily manage them, maybe with just a little bit of manual care thrown in there. I always joke with people that as soon as we turn 25, things slowly start going downhill, and we're both in our early 30s, so it's like, yeah, we know, we feel it. But yeah, no, so I'm happy that you're happy, essentially.
Yeah.
Did you have any other questions, comments, concerns? Is there anything else that you wanted to ask me for today? You can't possibly catch me off guard.
No.
So if you don't, that's fine. You don't have to ask me anything. I just wanted to give you that option.
Is there anything that you'd recommend? Like, I feel like the hip, like the back stuff, the neck stuff, like that's kind of, that's been like that forever.
Okay.
So I'm like, I'm okay with dealing with that. But like, is there anything you recommend to do with my hip moving forward?
So when you're talking about the hip, are you talking specifically about the hamstring complaint?
The hamstring, I guess.
Okay.
Yeah.
Okay. Yeah. So what very likely happened with where you're pointing to, that's the hamstring tendon. Okay. Tendons, and that's important to know because tendons respond better to physical rehab of a certain type versus muscle bellies.
Right.
Okay. So again, for the hamstring, tendon's going to be up here, tendon's going to be down here, and muscle belly going to be in between.
Yeah.
So for you, do you do any kind of resistance or weight training at all?
Yes.
Yeah. Okay. What kind of moves are you doing in the gym?
Whatever the trainer tells
Whatever the trainer tells you. Okay. So essentially, where do you go? What gym do you go to?
I go to FP Fitness.
FP Fitness. Okay, so they're pretty knowledgeable with FP. Actually, that's Keon. I know Keon. Never mind. Keon's knowledgeable. Keon, you're watching this. You're going to give her heavy eccentric hamstring movements, okay? So that's going to be either I don't know if you guys have hamstring curls, but you're going to give her Romanian deadlifts with an emphasis on the eccentric component, okay? Keon, we made a video with him early on this channel. Y'all can check the top right corner for his video. We'll put it up there. But yeah, so essentially tendons respond well to something called eccentric movements. Do you know what eccentric means or no? Okay. So if you're doing a bicep curl, per se, hand me your water bottle. If you're doing a bicep curl, the concentric component is bringing it up. The eccentric component is resisting the lengthening of that muscle, controlling the descent. Okay.
Yeah.
So if you're doing a Romanian deadlift, it would be about slowly controlling that lowering down because that's lengthening the hamstring. Really slow on that one. That's going to help to strengthen up the tendon, relay down new collagen fibers, hopefully get rid of that nagging pain in the glute there. Okay. Regarding the hip itself, the more movement you do, the better. Typically, motion is lotion. Use it or lose it, whatever kind of fancy catchphrase you want to use. If you're sitting and you're commuting for a long distance, you're putting a lot of pressure on that. Get up, walk around, walk your dog, cat, bird, whatever it is you have, right? Those would be my recommendations in that case. Do you have any other questions at all?
No, that was it.
Awesome. Well, Jess, it was really nice to meet you. Thanks for coming in. Appreciate you taking the time today.
Thank you.
Have a good one.